Now, I just had a couple of minutes to answer some of the questions that you sent to Stephanie, and I really enjoyed reading those questions. They were really great, and it's funny how parents sometimes come up with questions that doctors don't think about or don't think of. One of the questions that I would like to start is somebody asked, why is there such a difference in the short and long-term effects in post-laser taps and spontaneous taps? So the spontaneous taps, the taps cases that occur out of the blue spontaneously, and the post-laser are the ones that occurred in case of TTTS that was treated with laser.
This question also just came up in the chat as well.
Oh, so, okay. Yeah. So it's two people asking the same question.
Yeah.
Well, it's true that in both cases, they are both caused by anemia and polycythemia. And in both cases, one baby is white and the other one is red. But probably in case of spontaneous taps, because those are the ones at risk, are more at risk, the donors for deafness and impairment on the long term, probably the anemia was there for a longer time. The disease was there for a longer time. In TTTS, on average, the laser occurs at 20 to 24 weeks of gestation, and before that, they did not have taps. Whereas in the spontaneous taps, it was already there before that. So probably the length of the period that the babies were sick makes that there is a difference between these two diseases. Then the second question somebody asked was if TAPS was a mild disease. It can be a mild, but it can also be severe. The larger the hemoglobin difference, the more severe it is. But sometimes it's milder, and then you don't have much to worry about. What treatments and tests are essential at birth? Well, I think we discussed that in the presentation just before. So it's important that to do the blood test and do the hearing test. What happens behind Nicu doors for those babies once they are out? Well, again, as I explained you before, we try to do this test, but I don't know what happens behind every Nicu doors. I am afraid that behind most Nicu doors, most people are not really aware of what TAPS is. So we are trying to create more awareness and telling people and doctors about this disease. It's a rare disease, so there is nothing wrong about doctors maybe not knowing all the details. But if you as a parent know more about TAPS, well, you might educate them too. And then there was a very interesting question about somebody had a donor with TAPS, and this baby had low iron levels at 9 months, despite the fact that the iron levels were high as newborns. And what the question was, could this be related to TAPS? I never thought about this. I don't know that because we don't measure regularly iron levels at 9 months. Iron is something that is very important for babies. So if they are too low, then it's important to give them iron. So it's very good that they check the iron levels. It's important for your development. It's important for many, many things. Normally, if you have a lot of iron because you had a lot of, you broke a lot of, you produce a lot of red blood cells, you usually have high iron for a long time. But maybe in this case, the baby was using so much iron that at the end it's, is reserves. Reserve, is that English?
Yeah.
Reserve of iron will kind of went down, so the baby at the end, at 9 months of age, didn't have enough iron to compensate for the initial. We need iron to make red blood cells. So if you use a lot of it, you probably got rid of too much of your iron. So maybe it's something, when I read that we should look more into details and see if that's the case in more donors with TAPS.
I can actually tell you anecdotally within our Facebook group, when we've talked about donors being low in iron, We have many parents who are saying that their donors are low in iron up to H2, or low, have either anemia or low iron levels up to H2.
Okay.
Yeah, so this is just something that comes out of our group randomly in conversation.
But these things that come up are very important for us as doctors because we never thought about doing a study and looking at that.
Yeah.
But maybe that's something important. Again, iron is important for your development. So if that's something that we are missing, we need to look more into detail into that.
Yeah, because I know that with Emily, they followed her up until age 2, and she was at age 2, she finally had a normal iron level. So yeah, just anecdotally, that's something that comes up in our group quite often, and the answer is we always give is we don't know. I have a research question.
Yes.
Yes.
Thank you. And then I hand it over to Shani. You said you had
there
a
are more questions.
Oh.
There are a few more questions. The one from there is one on managing post-laser taps and TTS. I think we'll leave that till the end of the session. So we have seen it. We promise we will answer it later. There is one question that is it more severe when the hemoglobin levels are overall low, so rather than high, rather than 2 versus 12, or then 5 versus 15? Okay,
so I understand. Is it more the difference, or is it the fact that one is very low? So I guess that we don't have the real good data about that, but 2 is really, really low. So I would my impression is that the lowest the hemoglobin level in the donor, the more heavy time this baby has.
Yeah.
So they can compensate quite for a while, but well, it's a hard time for the baby to have such a low hemoglobin levels without receiving any transfusion.
Okay.
So severe anemia is probably something we want to avoid.
Yeah. And so we have one more question that's kind of related to that. Should we be asking for blood testing after they leave Nicu and with their doctors just to check their iron level?
Well, now that I heard that, it's something that we need probably to do, and we don't have that in our guidelines yet, but it's something that we need to think about it seriously and repeat it. Maybe, and if the baby is doing all right and has good hemoglobin level, is thriving, then there is probably less to worry about, but still maybe there's some things that we don't see but could be there. So I think we'll start a study on that.
Yeah, I think so.